Hi, I'm Dr. Javier Jimenez. Some people call me Dr. X. Welcome to my YouTube channel. This is just a short video about me. Well, I'm Javier Jimenez first, before I became a physician. I'm from Miami, Florida. That's where I was raised. I'm of Cuban American descent. My family emigrated from Cuba because of difficult times and political turmoil in Cuba, and started with nothing and gave me a great opportunity to seek education and work in this country. I studied high school, completed high school in Miami, then went to the University of Miami and majored in both biology and philosophy. After that, I pursued a master's degree in Cleveland, Ohio at Case Western Reserve University in bioethics. I was very interested in the interface between medicine and philosophy, and hence bioethics. After that, I decided, let me in fact become a physician. I have an aunt who's a retired pathologist who influenced me, and I went into medicine because I wanted to help people directly, not just philosophize. And so I became a medical doctor. After that, decided within the branches of medicine that psychiatry was the richest and most interesting. I studied that. I became a psychiatrist, but then decided I want to go back to the medical space and practice psychiatry in the medical space. So I pursued more training at Mass General Hospital, part of the Harvard system, and studied what's called consultation psychiatry or medical psychiatry. After that, I started my first job as a medical psychiatrist at the Cleveland Clinic, and I was there for about 8 years and worked with a variety of services, whether it was neurology, orthopedics, dermatology, bariatrics. I also led an interesting program called the Chronic Pain Rehabilitation Program. I was the medical director of that. I became pain medicine and addiction medicine specialized. This was all during the opioid crisis. Then I took a leadership job at Northwell, where I'm currently the director of consultation psychiatry and chronic pain. And I continue to use these skill sets and experiences to help people with chronic pain, mental health concerns, and addiction. In my line of work, I can reach so many individuals. I see patients that are sent to me from other doctors. I see them in the hospital when they're ill, and that is fulfilling. I get to help a certain number of individuals. But in starting a YouTube channel like this, I have the opportunity to really reach more individuals and spread awareness. Topics like mental health, chronic pain, addiction are very difficult to face due to stigma, and they're difficult to understand sometimes conceptually. So I thought a YouTube channel would really allow me to reach more individuals, maybe their families, their friends, others who are struggling. That is the whole idea with this. And I'd like to also join conversations with other thought leaders out there so that we can advance the field and help more individuals who are out there in the community wondering what they can do about their mental health, chronic pain, or addiction. If I were to select one that was really difficult and transformative, it was actually a terrible, tragic event that occurred while I was training as a psychiatrist at University of Pittsburgh Medical Center. Sadly, one day when we were in the middle of our courses and our coursework, an individual came in with 2 pistols, with 2 guns, and stormed our psychiatric facility and shot up the place, shot a number of individuals. He killed a therapist. Tragically, he hurt some others. We had to be evacuated with SWAT team and a number of other precautions. And for me, it was a transformative event because in this space that is intended for healing, for reducing stigma, for alleviating trauma, we had such a horrific event. And I continue to think about the interface between mental health and society and law, the epidemic of gun violence and difficulties that we have in this country getting around that issue. That moment, I think, was very personally and professionally transformative for me because it brought so many things together at once. I think the part that is easily misunderstood is this sort of identity of a psychiatrist. I think people, by virtue of what I do more of, think that as a psychiatrist, I'm just interested in shrinking heads, and that I'm only concerned with depression and anxiety. When in fact, if you look at my training and my background, I've spent much more time in medical spaces as a physician in the trenches in these various medical spaces than as a conventional psychiatrist. And that's purposeful. I think all of health is mental health, and all of mental health is health. Medicine really needs to do a better job of embracing mental health as part of its goal. And I think that is one way that mental health in general is misunderstood, and my identity as a psychiatrist is misunderstood. I think there are many things that we can do better in healthcare, and I hope that my content can alleviate some of those concerns. Some things that I would love for individuals to take away is, of course, a reduction in stigma around mental health topics, chronic pain, and addiction. I think something that we all tend to forget, myself included, is that 100% of humans have brains and 100% of brains have minds. And those minds have very complex psychologies. And we sometimes don't really pay enough attention to that. Each individual has his or her own universe inside of them, their personality, their culture, their upbringing, their ethnicity, their gender, etc. All of that is very important, and we don't do enough, in my opinion, to really understand that subjectivity, that individual's psychology. It gets even more complex when that psychology starts interfacing with others. So, what do I want my content to do? I want it to allow other individuals to see the psychology, if you will, or the mental functions of each individual, but also healthcare at large. This is what I like to phrase as mindful medicine, and I think it's really important that people take that away from the discussions and conversations that I share with them. Yeah, I think the big task for me, or the big goal for me, is to try to figure out how to incorporate more mindfulness in medicine at large. So what does that mean? That means, for instance, cultivating in other physicians, nurses, administrators, doctors, etc., a more mindful stance as to the individual that they're taking care of. I'm not even talking about patient-centered care. I'm talking about person-centered care. This also translates to the patient themselves. I would like them to reflect more on their own inner psychology. Too often, people just don't, because it's invisible, it's hard to understand, there's stigma. I'd like to break down some of those barriers, demystify those processes, and I'm still trying to figure out how to do that. This YouTube channel is an attempt at that, putting out content, leveraging education, taking comments from others, and really interacting with those out there. That's my best attempt at trying to cultivate more mindfulness in medicine. Follow me for any more information on the conversations that I've shared here, whether that's on chronic pain, addiction, mental health, mindful versions of medicine, or even ethics in medicine.